All right, listen up, medical students and future physicians. Welcome to this high-yield parasitology bootcamp explainer. Today, we're not just taking a casual stroll through micro, we are cracking the ultimate exam traps. I'm going to push you, I'm going to test you, and I demand your absolute focus right now. Why? Because board examiners are absolutely ruthless, and this material is non-negotiable. We're taking this dense source material and transforming it into high-impact, testable facts. So grab your coffee, clear those distractions, and let's conquer the parasite universe together.
Okay, here's our game plan for today's rapid-fire review. First, we'll establish the rules of the parasite universe. Then, we hit flatworms, your cestodes and trematodes. Third, roundworms, or the nematode threats. Fourth, high-yield blood and tissue protozoa. And finally, we'll wrap up with the ultimate exam traps. Let's dive in.
Section 1. Rules of the Parasite Universe.
To absolutely crush the boards, you can't just passively memorize. You have to understand the foundational laws of how these bugs operate. You need to drill this fundamental distinction into your brain right now. Protozoa, they're unicellular. They multiply rapidly inside humans, kind of like bacteria, which means a totally naive patient is going to get severe, overwhelming disease on their very first exposure. Helminths, on the other hand, are multicellular worms. The golden rule for helminths is that they require external hosts, and, this is key, they do not multiply in humans. Because they can't multiply inside us, severe helminth disease requires repeated, continuous reinfections over time. That means residents of endemic areas get hit way harder than short-term travelers. But beware, examiners absolutely love testing the exceptions to this rule, which we're going to see in just a minute.
So this brings us to host definitions, and honestly, this dictates literally every single clinical vignette you're going to face. Humans act as the definitive host when we ingest the larvae. The larvae just chill and develop into adult worms in our intestines, causing mild or sometimes even zero symptoms. But if humans ingest the ova, the eggs, we become the intermediate host, and that's bad news. Those ova hatch into larvae inside us, penetrate the gut wall, and migrate straight to our organs, causing severe systemic disease. So remember, ova equals severe. Burn that into your memory.
Moving right along to Section 2. Flatworms, cestodes and trematodes.
Let's rapid-fire the cestodes, the tapeworms. I need you listening closely here. Lock onto these specific vectors and buzzwords. Taenia saginata comes from undercooked beef. It's an intestinal tapeworm, usually totally asymptomatic. Diphyllobothrium latum is the fish tapeworm. The exam buzzword? Vitamin B12 deficiency. It avidly sucks up your B12, causing megaloblastic anemia. They love testing this in patients of Scandinavian descent. Next, Echinococcus granulosus. You get this from dog feces or sheep. It causes hyded cysts, usually in the liver. The extreme board trap here is that if this cyst ruptures during surgery, it causes massive, potentially lethal anaphylaxis. Finally, Echinococcus multilocularis comes from foxes and causes a much more invasive, nasty, tumor-like alveolar cyst.
Now here's where it gets wild. Applying our host rule to Taenia solium, the pork tapeworm. If the patient eats undercooked pork containing the larva, they just get a mild intestinal tapeworm. No big deal. But if they ingest the ova, say from contaminated water or feces, they develop severe neurocysticercosis. We're talking cysts in the brain, leading to seizures, hydrocephalus, and focal deficits. This is heavily tested because it is literally the most common preventable cause of epilepsy in developing countries. Again, ova equals severe CNS disease.
Let's hit the trematodes, or flukes. You got to associate specific schistosoma species with their clinical calling cards. Schistosoma monsoni and japonicum. They penetrate the skin right from freshwater snails, head to the liver, and cause massive portal hypertension and cirrhosis. But Schistosoma hematobium, also from snails, but it makes a beeline for the ureter and bladder. Think hematuria and chronically squamous cell carcinoma of the bladder. Moving down, Clonorchis from undercooked fish causes biliary obstruction and has a super high risk of cholangiocarcinoma. Finally, Paragonomus. You get this from undercooked crabs or crayfish. It causes pulmonary cysts with hemoptysis, and it absolutely mimics tuberculosis on the exam. Don't fall for it.
Section 3. Roundworms, the nematode threats.
Shift gears from flatworms to roundworms. Keep that attending level focus because we are moving fast. Let's dictate the vignettes for these intestinal nematodes. If you see a patient with a bowel obstruction or eosinophilic pneumonia, that's Loeffler syndrome. From eating contaminated soil, that's Ascaris. If they present a barefoot kid playing in soil who now has profound iron deficiency anemia, you must immediately click hookworms and move on. They attach to the gut and literally suck blood. If a kid has bloody diarrhea and rectoprolapse, Trichuris, the whipworm. And the absolute classic, a kid with nocturnal perianal itching diagnosed with a Scotch tape test? That, my friends, is Enterobius, the pinworm. All right, remember that golden rule I gave you earlier? Helminths cannot multiply in humans. Well, here is the biggest, deadliest exception in parasitology. Strongyloides stercoralis. It can complete its entire life cycle inside humans, which allows it to auto-infect. In an immunocompromised patient, this spirals into a massive, deadly hyperinfection syndrome. The larvae disseminate to multiple organs, and they actually drag gut bacteria along with them, causing horrific gram-negative bacteremia. You must check strongyloides serology before starting steroids in someone from an endemic area.
Let's link specific vectors directly to these highly tested tissue and blood nematodes. Wuchereria and brucia are transmitted by mosquitoes. They obstruct the lymphatics and cause elephantiasis. Onchocerca volvulus is transmitted by the bite of a black fly near fast-flowing rivers, and it causes severe skin pruritus and river blindness. Loa loa, transmitted by the deer fly in Africa. This is the eye worm that literally migrates right across the subconjunctival tissue. You can see it. And trichinella comes from undercooked pork or wild game like bear meat. The larvae migrate to skeletal muscle, causing severe myositis, eosinophilia, and that classic periorbital edema.
Section 4. High-yield blood and tissue protozoa.
Okay, we're leaving the worms behind and entering the realm of the unicellular killers. These bugs evade the immune system and cause overwhelming, rapidly multiplying infections. First up, malaria, caused by Plasmodium. Plasmodium falciparum is the deadliest, hands down. It invades all erythrocytes, causing high parasitemia and severe cytoadherence that leads straight to cerebral malaria. But look closely at Plasmodium vivax and ovale. Their key feature? They hide out dormant in the liver as hypnozoites. This means they will relapse months or even years later if you don't treat them properly. You have to add primaquine to their treatment regimen to wipe out those liver hypnozoites.
Time to drill vectors and signs for CNS and tissue protozoa. Toxoplasma gondii comes from cat feces or undercooked meat. In congenital infections, you're looking for the classic triad: chorioretinitis, intracranial calcifications, and hydrocephalus. In AIDS patients, it causes multiple ring-enhancing brain lesions. Trypanosoma cruzi is transmitted by the reduid bug, also known as the kissing bug. This causes Chagas disease. The chronic hallmark, dilated cardiomyopathy and megaesophagus. Trypanosoma brucei comes from the tsetse fly and causes African sleeping sickness. And leishmania? The vector is the sandfly, and the visceral form causes massive hepatosplenomegaly, fever, and anemia, also known as Kala-Azar.
Examiners love mixing up these water and contact protozoa, so let's set the record straight. Naegleria fowleri is contracted by swimming in warm freshwater lakes or hot springs. It shoots up the nasal route and causes a rapid, universally fatal meningoencephalitis. Acanthamoeba, however, is your classic vignette of a patient washing their contact lenses in tap water, resulting in severe, sight-threatening keratitis. Giardia lamblia is a waterborne fecal-oral transmission causing totally foul-smelling, watery diarrhea and bloating, but no blood. Finally, babesia. This is transmitted by the Ixodes tick. Yep, the exact same one that causes Lyme disease. It causes a malaria-like illness that is exceptionally severe and potentially fatal in asplenic patients because they lack a spleen to filter out the parasitized red blood cells.
Now, Cryptosporidium presents a massive public health trap. It causes huge outbreaks of watery diarrhea, and it's especially dangerous in immunocompromised AIDS patients. Why? Because its oocysts are fully 100% chlorine-resistant. Standard municipal water treatment completely fails to kill it. When you see a massive waterborne outbreak in a community despite standard city sanitation, you've got to think Cryptosporidium.
Section 5. The Ultimate Exam Traps.
Welcome to the final boss. This is a rapid-fire gauntlet of the top examiner tricks you must recall under pressure. Trap 1. Strongyloides auto-infects. You must check serology before giving steroids. Trap 2. Eating T. soliumova causes severe CNS cysticercosis, not just a mild tapeworm. Trap 3. D-Laudium causes vitamin B12 deficiency. Do not let them trick you with folate. Trap 4. S. hematobium is your hematuria and squamous cell bladder cancer fluke. Trap 5. If the vignette says eosinophilic meningitis after eating undercooked snails or prawns, the absolute #1 cause is angiostrongylus.
Let's finish strong. Trap 6. Plasmodium vivax and ovale hide in the liver. They demand primaquine to prevent relapse. Trap 7. P. vivax needs the Duffy antigen to enter red blood cells. West Africans naturally lack this antigen, meaning they're completely protected. Trap 8. Don't confuse the amoebas. Naegleria is from swimming, Acanthamoeba is from contacts. Trap 9.
Chagas disease chronically ruins the plumbing and the pump, megaesophagus, and a dilated heart. Trap 10. T. brucei rhodesians from East Africa is rapid and fatal within weeks, while the Gembians form from West Africa is slow and chronic.
I'm going to leave you with a classic board-style vignette. A patient from West Africa presents with malaria. They are Duffy antigen negative. Which Plasmodium species are they protected from? Answer this in your head right now to prove you're ready for test day. If you instantly knew the answer was Plasmodium vivax, congratulations, you're surviving the boot camp. Keep reviewing, keep grinding, and whatever you do, don't let the examiners catch you in these traps. See you next time.